Congregation's Health Cabinet Secretary Cleopa, Mailu and Principal Secretary Nicholas Muraguri appeared before the Senate Committee on Health to answer to claims that 3.2 billion shillings was lost at Afya House.
The two argued that it's not until the audit report and investigations are completed that Kenyans can get the true picture.
The Afya House scandal probe continued Tuesday as Health Cabinet Secretary Cleopa Mailu and his Principal Secretary Nicholas Muraguri appeared before the Wilfred led Senate Health Committee. CS Mailu revealed how PS Muraguri had requested Treasury to transfer the auditor as the audit was underway.
On 19th of October, I received a copy of a letter written by the Principal Secretary National Treasury to the Principal Secretary in the Ministry, responding to his letter of 12th July, which I didn't have a copy, affirming that the auditor will continue to audit the ministry until end of October, and in November, somebody else will be posted to the ministry to take over the leadership of the internal audit.
Muraguri refuted the claims, saying he only requested for a more experienced auditor, adding there was no evidence of him demanding for the auditor's transfer.
It is public knowledge that you, the PS, did request that the auditor be moved from the Ministry of Health just before he released this interim report, a month or so, or some period. Could that have been the pressure for the leak that caused the leak of the report? What was going on? Why did you want the auditor really moved out of that ministry?
I never did that. What I asked is for a more competent person to help us improve our internal audit systems.
The ministry was also put to task to explain the planned refund of $1.6 million to the Global Alliance for Vaccine and Immunization (Gavi) meant for child immunization, which could not be accounted for.
People were moved, offices were moved. We could not be able to get proper documentation because of that movement. Remember, we are also two ministries. We had medical services and public health. And a lot of activities were happening around Gavi programs in both ministries. Remember, we merged. People were transferred. In counties as well, people were moved. Some of the money was sent directly to the MOHs then, this is the Medical Office of Health. Some had already been moved out. So the challenges we had was access documentation and paperwork that supported various activities.
The two officials in the spotlight have maintained that no money was lost and conclusions can only be made once the audit process is completed following the allegations or the manipulation of IFMIS system for payment. Caroline B., KTN News.